Hello friends, Sarah here from the Centre for Mental Health. I hope all is well. I haven't done a film for a while, but I hope you've seen all of the content we've been putting out there recently, and do let us know what you think. We're still always concerned with what you want to know about, and so yeah, do keep in touch as always. We thought it would be a good idea to talk with you about the Panorama programme that came out this week and the CQC report on restraint and seclusion in care. And the reason for that is because, like you, we felt very distressed at what we've heard and what we've seen. The Panorama programme was dark, it was bleak. It was full of abuse and torture, and I really have been left feeling deep shame that still in the UK we are uncovering circumstances in which the people who we should be caring for the most vulnerable, are in hostile and dangerous situations. I don't think anyone who watched that programme has been left untouched by it. And so I really hope that Alex and Claire and the other people from Walton Hall are in a place of safety today and are being cared for and are receiving the compassion and the empathy that they deserve. And I'm truly sorry that they and their families have had to endure such terrible circumstances. We've been here before though, right? We saw what happened at Winterbourne, and we're here again, and it's not okay, it's not good enough. Why haven't we learnt the lessons that were so explicit and laid out then? The lessons clearly are going to be the same this time. So we at the Centre are really concerned with how are we actually going to turn these experiences into action, into meaning. How can we assure people receiving services and families can be reassured that people are safe? Well, we think there are 7 things, and the first thing is we still believe that society have a long way to go in terms of understanding the needs of people with learning disability and autism. We're not quite there yet. We also think that the mental health needs of people with learning disability and autism are currently not being met, and we know that people with learning disability and autism have higher rates of mental illness. So we really urge services to take some steps towards understanding the mental health needs of their residents, patients, service users. You can't really have interventions with one without the other. It's mind-boggling to me that we would even try. We at the Centre also want to see the recommendations made in the Mental Health Act review are implemented as a matter of urgency. They talk about dignity, they talk about integration, they talk about really making sure that the Mental Health Act is used appropriately, in the right time, in the right place. We also want to see, as part of the long-term plan, a real investment into community services that are going to allow people with learning disability and autism with mental illness to receive services close to home. We don't want to see people being sent miles away from family and friends. Again, that defeats the notions of recovery or the potential for someone to live a fulfilling life. It's not okay to be separated from your home. It's not good enough. We should do better. We also really want to understand what happens in organisations. What happens in organisations that somehow creates the conditions for such violence to exist? What's happening in terms of the governance, the infrastructure? What's happening in terms of the support, supervision, the training? Are people being encouraged to deliver care from a values-based perspective? That compassion and empathy are the words that are used in everyday kind of language around care. How does it happen that so many people in one team can be so incredibly hostile and dangerous. What were the managers doing? What were the senior managers, senior leaders doing? It kind of leaves me wondering about how we as leaders create the conditions in which compassion can thrive. There are so many factors here and it's incredibly complicated. We have to also understand that compassion is actually really difficult to do if you as a staff member feel pressured and uncared for. And so whilst I absolutely condemn the actions of the individual staff that we saw in the Panorama programme particularly, I also want to make clear that we really need to understand why they behaved in that way. What happened? And the final thing that we're concerned about is regulation. So obviously regulation is such an important, significant part of our ability to stay safe for our people that we feel most concerned about. This is where we can make sure that there is a kind of safety net. The CQC have absolutely condemned the behaviour that they saw in the Panorama programme, and of course their report on restraint made it absolutely explicitly clear that practice around restraint and seclusion is currently the worst it has been, and that actually so much more needs to be done to help services and staff really understand how to work with individuals in a way that means restraint is not needed. I know that you can work with people in great distress without the use of restraint. I've seen it happen. I've been in those situations myself. So it demands a huge amount of courage from leaders to really think about opening themselves up to some of the most difficult debate. It demands significant culture change across the system. It demands an honesty about what it's like to care for people in those environments, and how do we enable staff to maintain compassion even under the most difficult circumstances. We know from previous work about locked rehabilitation that it's really easy for the system to turn a blind eye, to almost think, well, if people are in residential care or in hospital wards, they're safe. Well, most people are safe, of course, but some people aren't. And some people are certainly not receiving the care that they should, or having the opportunity to live a fulfilling life. So the challenge is for us all not to keep moving on from the difficult stuff. We really need to stay with the feelings that the programme and the various reports that have been launched this week have engendered in me and others. We need to stay with the determination and the commitment to do something differently. And as somebody who loves a child with autism, I personally feel incredibly committed and focused on raising the profile of care with dignity and respect. I leave with you a kind of plea to take these things forward wherever you are. We are all mutually responsible for making sure that the most vulnerable people in our society are safe and that they get the best care, a fulfilling life. So the challenge is for us all not to keep moving on from the difficult stuff. We really need to stay with the feelings that the programme and the various reports that have been launched this week have engendered in me and others. We need to stay with the determination and the commitment to do something differently. And as somebody who loves a child with autism, I personally feel incredibly committed and focused on raising the profile of care with dignity and respect. I leave with you a kind of plea to take these things forward wherever you are. we are all mutually responsible for making sure that the most vulnerable people in our society are safe and that they get the best care. It's a really difficult conversation we need to have, and I'm gonna put my feet in, and the centre will be right there too. So let us know what you think, and speak next time. Bye.